We get so focused on the day of surgery, but really there is a lot that goes into preparation that has a huge impact on your outcome. We want to identify and minimize any risk factors to avoid complications and maximize your body before surgery to improve recovery. So follow me and I will take you through the 7 steps of preparing for surgery. When we elect to go forward with surgery, we review the procedure and you will sign an informed consent. This is my scheduler. She's awesome. She will call you later that day to choose a date for surgery. I typically book about a month out. Next step is preoperative testing, and this involves a few tests. Here we are making sure your body can handle the stress of surgery and are looking for any potential issues that could arise during or after surgery. Once all your tests are done, you will have the results reviewed by me and your primary medical doctor to ensure surgery is safe. You will get your medical clearance. A few sessions of physical therapy goes a long way to getting your body prepared and speeding up recovery. We sit down one more time in my office before the surgery to review any questions or concerns. It's the day before surgery. You will get a call from the hospital telling you when and where to go tomorrow. You cannot eat or drink anything after midnight, except for next morning's medications that were approved by your doctor. You have done all your preparation. Now it's time to let me do a great job in surgery.